Day in the life of an ER nurse. Clock in time, 7 a.m. All right, y'all, we're doing something a little bit different today. We're going on the urgent care side. Come on, let's go. We are a level 2 trauma hospital, but we do have an urgent care department, and that's where we are going to be working today. But here is a sneak peek of our trauma department. This patient was involved in a motor vehicle accident, so we have lidocaine and Tylenol for pain and also prednisone for inflammation. This patient was diagnosed with influenza A, so we have guaifenesin for cough, Tylenol for pain, and Zofran for nausea. Motor vehicle accident number 2. We have an order for ketorolac, which is Toradol, 30 milligrams. This is going to be administered IM, which is intramuscular. After we apply the cap safely, we are going to push the syringe up and make sure there is no air bubbles. This is a 1-inch needle because it has to go deep inside the muscle. I've been floated back to psych, and I have a patient that is detoxing from alcohol. So I am preparing some Zofran, which is going to help with the nausea, and I'm going to administer it through the patient's IV. Typically, LPNs cannot administer anything through the IV, but I am in the emergency department and I have received special training. Right now, I am meeting with my coworker because we are going over the patient's CWA scale, and I am going to insert a clip on what the CWA scale is. And our patient did score pretty high, so we are also going to administer some Ativan. Typically, when a patient is detoxing, they are also in pain. So we have an order for 15 milligrams of Toradol, which I'm going to do an IM injection. Can't do it through the IV because the patient would have to be on a cardiac monitor, and this is just a lot easier. I just love seeing these brown doors in reverse. Clock out time is 7:30 p.m. and it is time to go. It's been a pretty good shift. Real busy, but pretty good. See you guys tomorrow.